Hello, my name is Colm Hanratty.
And my name is Coughlan. We are interventional cardiologists and we work together as part of the complex PCI team in the Mater Private in Dublin.
PCI, or Percutaneous Coronary Intervention, is a procedure where we improve blood flow through the arteries to the heart muscle. This is commonly known as stenting. In certain scenarios, the anatomy or the coronary arteries are more challenging, more difficult to treat, and this is referred to as complex PCI.
We treat patients who have complex problems with the arteries that supply their heart. And often these patients will have significantly impaired quality of life, so they'll have issues like chest pain, shortness of breath, reduced energy, and reduced exercise tolerance. And often these patients will actually have been seen by other cardiology services or other doctors. And in some cases, these patients will actually have been told that there's no treatment available for their condition or that they're too high risk to be treated.
Most people undergoing percutaneous coronary intervention or PCI have rather straightforward coronary lesions treated. Those patients that have more complex anatomy, the artery may be completely blocked. It may be heavily calcified. The patient may have had previous cardiac surgery. It may involve the main coronary artery. These are technically much more difficult scenarios, and we would refer to these as complex PCI. The sort of patients we're looking to attract are those patients who have been told that they have a problem with the coronary arteries that can't be treated, either because it's calcified. Often patients are told it's at a junction, they're told that it's difficult or the artery is completely blocked. We're not saying that all these arteries are treated. We would certainly suggest you seek out a second opinion.
The complex PCI service aims to provide a viable and streamlined pathway for these complex patients. So to do this, we run a weekly 2-consultant complex operating list where we perform high volumes of these complex procedures. And this has given us an extensive experience in treating these kind of patients and allows us to treat large volumes of patients safely and efficiently.
To be seen at the complex PCI service, we would ask you to get a referral letter from your GP or your cardiologist. Alternatively, if you have a referral letter from before, you can email us directly at the Mater Private Network.
So you don't necessarily need to bring any information with you to your appointment, but of course many of our patients will have had extensive cardiac histories, and it's always useful if we have information about previous angiograms, previous stenting procedures, or previous surgeries that you've had. And for many of our patients, that's not always possible, and often we have to perform an updated coronary angiogram to better understand the relevant issues.
We believe that no coronary condition should be considered untreatable without a second opinion. Our objectives are to try to improve the quality of life of the patients with complex coronary disease.
I think the main message is that if you or someone you know is suffering from complex coronary disease, we're here to help, and we'd be delighted to see you here in the Mater Private Network in Dublin.